Hi, everybody. I'm Sarah from Milwaukee Mom, and joining us today are three certified nurse midwives from Ascension, Wisconsin. And we're excited to have this conversation today because if you're like me, you hear the word midwife and you immediately think about babies, babies being birthed. And for the longest time, actually, until I met two of these three midwives through Ascension, I honestly had no idea that midwifery is about a lot more than just bringing babies into this world. They can provide a full spectrum of care, literally from the time of puberty all the way through menopause, and with a lot of our primary care. And so we want to just have a conversation today about what midwifery care looks like, some of the big questions that people might have about it, as well as some of the services and care provided that you might expect from a midwife. So Shannon and Greta, why don't you start us off? Tell us a little bit about you.
Take it away, Greta.
So my name is Greta McCool. I, along with Shannon, we're the founding members of the St. Joseph Midwifery program. I'm a mom of three. My kiddos are 5, 8, and 11. And I do have a few interests outside of midwifery. Right now, most of them center around getting my children to their various programs.
And I'm Shannon. I joined Greta in this practice December 2019. I originally grew up in St. Louis, and I enjoy now being here in Milwaukee. I had a baby about a year ago. She just turned 1 this past Saturday. Greta was there to help me. We kept it in the family for this practice, and I'm excited to keep growing it here with Greta.
Hi, my name is Alyssa Bresnan, and I am a certified nurse midwife and women's health nurse practitioner. I am currently out of the Ascension Franklin office, but I am delivering over with Greta and Shannon at St. Joseph Hospital.
When you were starting in your career, like what really attracted you to midwifery? What made you want to decide to be a midwife?
I actually was studying English and philosophy and religion in college, and I loved, for some reason, to research midwifery and how it related to different pieces of literature and how it related to religion in different communities. And at a certain point, I was sitting there thinking, why am I just studying midwifery? Why shouldn't I be one? Because I was really attracted to everything midwifery meant, which I'm sure we'll talk about later. So that's my initial draw. I thought I would be a lawyer and advocate for midwives to practice all over the country, and now I'm doing it.
So I have always been really interested in women's health. When I was 5, I thought I was going to be an OBGYN, and through all the twists and turns of life, I got into nursing. And while I was a nurse on a pediatrics post-surgical unit, I really loved caring for the babies. So I became I became a nurse in the NICU, and I really loved attending the births. So I became a labor and delivery nurse and found just how much I could do actually being the provider of care for women. So I completed my master's degree and became a nurse midwife. And through all of this, I got to hear stories about how my great-great-grandmother was not only the midwife in the rural Upper Peninsula of Michigan, but she was also the local veterinarian. So this is really family history carrying on down here in Milwaukee.
Yeah, so I have always been interested in the human body, which kind of initially drew me to nursing. And then during my undergraduate time, I had this great opportunity to teach a women's health course to female refugees from all over the world. And I just really enjoyed getting to educate these women and these girls and to help them feel empowered in managing their own health and kind of integrating that into their diverse cultural and individual needs. I then a couple months later saw a beautiful birth for the first time, and it was just the most magical, amazing thing, but also the most normal, everyday thing I had ever witnessed. And I knew that I wanted to continue supporting birthing people and continue supporting women through the lifespan, just in whatever manner that I could.
So when describing that, all of you kind of really refer to this sort of philosophy of care or a kind of like discipline around midwifery that really attracted you to it. Can you kind of elaborate a little bit more on what that means to you, or what or to put it a little bit more bluntly, like what is care with a certified nurse midwife look like in comparison to what a lot of people might be familiar with an OBGYN?
When I was studying English, the word authority I found was related to the word author. And I really connected with the idea of the woman or the person being the author of their own story, the author of the care that they wanted. And midwifery was the best model to support that. It really places the woman and the person at the center. It promotes health rather than looking at pathology. When you go to the doctor, usually there's something wrong. When you go to a midwife, you're saying, how am I going to support this healthy pregnancy? How am I going to support being the healthiest version of myself? And there's that model. And then I think we tend to turn it around and say, how do you want to be healthy? So I liked that it's a team-based approach, and it really helps support what the woman wants for her health goals.
I love that in midwifery that we focus on the start of having periods, otherwise known as menarche, and childbearing and childbirth and menopause as things that are normal and natural and things that we can help manage symptoms, but in and of themselves, they don't need to be managed. They are something that women get to experience. Also, with our ability to, write prescriptions and do screening exams, provide some primary health care, we really get to look at women holistically.
Typically, in comparison with an OB, an appointment with a nurse midwife tends to be a little bit longer, which just gives us a little bit more time to address any needs you might have, discuss any questions, and we really get to know one another. We are trained to offer many of the same services that OBGYNs offer, such as family planning. We can perform biopsies, we can perform minor procedures, but we just don't perform surgeries. So we can lead vaginal births independently, but we can also scrub in to assist an OBGYN physician with a cesarean birth. In the labor setting, nurse midwife patients are statistically less likely to require pain medication, such as an epidural, though we can certainly order that for you if that's what you would prefer for your birth experience. I think that is the number one question that I get at my new patient visits is, can I have my epidural? Absolutely, if that's what your plan is for your birth. But nurse midwife patients are also more likely to have a shorter labor. They are more likely to have a vaginal birth and to do so without interventions such as Pitocin augmentation or forceps or vacuum-assisted deliveries. They are less likely to have perineal or vaginal trauma during birth, and it's just an abundance of benefits.
I was actually going to add on less likely to have a preterm birth because that's one of the biggest causes.
Ooh, okay.
Country, and that's true worldwide of midwives, and nobody knows why. There's no specific intervention we can find worldwide for why women who get care from midwives have lower risk of preterm birth, because that goes across the spectrum, high, low risk patients. There's something about midwifery care that's magical.
With that in mind, like at what age can a potential patient make their first appointment with a certified nurse midwife?
I think Greta touched on this. We can see you from your first period through you not having periods anymore. I know one midwife who used to say, if you're having one and it's a problem, or if you're not and it's a problem, we'll see you to chat about it, chat about your gynecological health. I've had girls come in before their first period whose mothers brought them in saying, oh, I just want her to be prepped mentally for what's happening, talk about some of the normal changes of puberty. And we love those discussions because the more that you know, the better.
Awesome. So basically throughout the entire spectrum of that life care, a certified nurse midwife can provide that for you. That's amazing. So if somebody is looking to get more information, or they want to make an appointment with one of you three or one of the other amazing certified nurse midwives in the Ascension system, what's the easiest way to look in to get more info?
We actually have this super wonderful link. It is ascension.org/MKEmom. So you are welcome to visit that. But of course, you're also welcome to contact our offices via telephone if you have any other questions, or if you're like me and you're old school and you'd prefer to make your appointment that way.